For trying to conceive couples, these are some of the tests that are very essential for you to go through so as to get to the root cause of the problem. As a man, it's essential you go for seminal fluid analysis. Men, because we don't show symptoms, we don't menstruate, we don't ovulate, so a whole lot of men have issues and they don't know they have issues. So if you've been trying to conceive for like a year or even 6 months, then from your end as a man, you go for seminal fluid analysis to check the sperm count. The total sperm concentration should be over 39 million, to check the motility, which should be above 40%, to check the morphology, which should be above 4 to 15%, and to check if there is presence of any microorganisms like staphylococcus and others. So if you are past, if all of these results is normal, like the sperm counts, the motility, the morphology, the volume, the semen culture, if everything comes out in flying color, then the lady from her end, she does pelvic scan to check the pelvic cavity, to check if there's any abnormality like ovarian cyst, like PID, like endometriosis, and other like fibroids, and other abnormalities that can affect the pelvic cavity and prevent proper fertility process to occur. Then if all of these are normal, like if the female pelvic cavity is normal, is seen to be normal, like there's no abnormality, there's no anatomical abnormality seen, then we can move further that, okay, let's check the female hormone, like let's check her hormone. Please note what I said. From the man's side, the first one is for him to check his seminal fluid analysis, that's to check the semen. Then from the lady's side, the first line is for her to do the pelvic scan. Then if the pelvic scan comes out normal, then we move further, which is to do the hormone assay test to check our fertility hormone, like the luteinizing hormone, follicle stimulating hormone, estrogen, progesterone, and prolactin, to check if these hormones are balanced. Because imbalance in any of these hormone can be the factor behind the infertility. The follicle stimulating hormone, it has its, all of these hormones have their ranges. They have the range they are to be in the follicular phase, in the ovulatory phase, in the luteal phase. So if they are within the right phase, if they are within the right range, then that means that the hormones are well balanced, and still she's not getting pregnant. Then we move further, telling her to go for HSG, which is hysterosalpingogram, which is to check the fallopian tube and the womb as a whole, if there's any abnormality. So HSG will be done to check the fallopian tube, and if there is any obstruction, then perhaps that is the main factor. Not even perhaps. If there's any obstruction, that is the main factor behind infertility, because with obstruction in the fallopian tube, it will make it very difficult for sperm cell to meet up with the female egg, because the sperm cell and the female egg, they will meet up in the fallopian tube for fertilization, then they will travel down to the womb for implantation. So if there's an obstruction in the fallopian tube, then this will prevent the sperm cell from meeting up with the female egg. And since the female has two fallopian tubes, if one of the fallopian tube is blocked and the other is open, then that means that she still has chances of having natural pregnancy. And if she's having bilateral non-patent fallopian tube, it means that both tubes are blocked, and that's, there are different factors that can lead to blocked tubes. There can be tubal adhesion, there can be tubal ligation, and other factors. There can be hydrosalpinx, which means fluid, collection of fluid in the fallopian tube, where there will be fluid, which is often as a result of untreated or infection that is not well managed, can lead to fluid collection in the fallopian tube. So, okay, we move further. The HSG shows that it's still normal, like the HSG comes out in flying color, but she's still not yet pregnant. Then we move, okay, let's check her AMH, that's anti-Mullerian hormone. Anti-Mullerian hormone test is done to check for the ovarian reserve, to check if the lady has egg, like if she has egg, especially if the FH and the LH is high. If there's high level of the FSH, which can indicate that the lady is getting closer to menopause, which means that the ovarian reserve is reducing. So we tell her to go for AMH. If it shows that the egg quantity has reduced, then perhaps that is the issue. Or it can even indicate that she doesn't even have egg at all. Again, I have a patient of like 37 years old then that's told me that she's done, I think like twice, she's done myomectomy, she did surgical removal of the fibroids, and this affected her ovaries, and to the extent that she's not having egg cell at all again. So she sent the AMH test result to me, and it reads that there is absolutely nothing again, and she's just 38 years. and in fact, she has no child of her own. So there is no egg there again. And the female egg is a provision from God. It doesn't increases, it decreases. As she ages, the egg ovarian reserve decreases. So it's not something you can add more to. Like, it's not something that can, okay, I want her to have more eggs. No, the quantity of the egg can be improved, but the quality, the quality of the egg can be improved, but the quantity of the egg can't be improved because it reduces, and that's why they get to menopause when the egg are no more there. So these are the steps that will be taken. Like, once again, from the man's side, you go for semen analysis. Now, if a man does semen analysis and it indicates that there's a problem in the semen, maybe he's having azoospermia or very severe oligospermia, then we need to move further to know the exact reason why he's having azoospermia. Then we tell him to go for scrotal scan, so we can see the testicular environment to check if there's any anatomical abnormality. Maybe there's varicocele, there's hydrocele, there's epidermal cyst, or there is epidermal otitis, or there's testicular torsion, testicular atrophy, and other series of conditions that can affect the man in the testicular environment, which can affect the testes and impair the testicular function and prevent it from being able to produce healthy sperm cells. So all of these are very important and essential steps to be taken to ensure your fertility health. Thanks so much. The Criterion cares.